Hey, this is Dr. David Myers, Utah Valley Dermatology, and we are doing some treating this young lady's hands today. So hands are kind of the new frontier in aesthetics and cosmetic dermatology. And why? Because we've been treating the face and people are looking more at their hands. And what can we do with it? Well, we can help take out veins by using sclerotherapy. And today we're actually going to use a great collagen stimulator and filler called Radiesse, which is kind of the standard in hand rejuvenation. And we're going to be treating her hands using a cannula. So what we do is it's pretty simple. We take some numbing medicine, and this will hurt a little, sting a tiny bit, sorry, poke. And I just put a couple little pokes, and she is tough. And that is virtually the only pokes essentially that she's going to fill. And then we get one of these and we're going to put in a cannula. And a cannula is like a blunt, it's like a blunt, in essence, needle. And why I like it is because then you don't puncture, take that out, you don't puncture any little areas that you don't want to. The cool thing is this kind of goes, which sounds crazy, but I'm pushing a little bit in here so that there's a little numbing medicine in there when I do it. And then I kind of draw back and I just put that filler where I want to put it. And again, it looks a little dramatic, but it's great. This is just kind of finding the plane of least resistance in there, and thus you don't hurt things like using a needle. We'll go over here. I just want to put it on this other side here. Kind of mold it over a little bit. Here we go, perfect. I'll take that introducer, please. And again, she's numb there, so that doesn't really. Just draw this back and put this into the plate, into the area I need it. And then I mold this into place. If you've noticed, that's really kind of taken out kind of the boniness in her really slender hands. And then I can kind of see, hey, where else do I need this? Well, I need a tiny bit here and a tiny bit there. And then we'll be done. And that's going perfectly. So it's a pretty quick procedure, and probably one of the least painful of all of them, just because it's 3 little tiny pokes with numbing medicine, and then we can use those little numbed areas to introduce this cannula. Okay, can I get a little clindamycin gel? So, she has I think that's kind of a really quick and excellent procedure, and that'll last over 2 years. I truly think in 3 years this will look better. And not that there will be much left of the product, but more because it stimulated a little collagen. It's been good over those couple years. I just get a little bit of Vaseline on top, or a little bit of antibacterial ointment, and rub that in. I've really tried to massage this where I want it. And then there you go. Great. Okay. And then we put a glove on, and then we put a little ice pack, and that's it.
And put a little ice pack on there.
Very slick. Okay.
Find the right fingers.
So that's hand rejuvenation with Radiesse, with a cannula.
Okay.
Great procedure, and I think it has excellent results. If you have any questions, please come find us, and we'd love to help out. Thank you very much.